If you are one of the nearly 9,000 New Zealanders who have a stroke each year, and if you survive, you might need inpatient rehabilitation. 1/3 of you will. This rehabilitation takes place in a dedicated hospital ward where a team of health professionals with different roles work together to help you recover. You may have trouble eating, speaking, walking, or thinking clearly, and every one of you is different. Not only are the effects of your stroke different, but you are different people, each with your own history. I, as one of these health professionals, need to learn as much as I can about you to make sure that the decisions we make and the care we provide reflect who you are, what you want, and where you've come from. Health professionals call these things patient values, preferences, and circumstances. But these terms can be a bit confusing, even for those of us who should be considering these every day. Think of these things as pieces of a puzzle, your puzzle. Each bit of information is a piece that helps to build a fuller picture of who you are. But how do we collect these puzzle pieces? How do we get to know you and understand what matters to you? My research explores how health professionals elicit this information and what they understand about these concepts. In this study, I interviewed 13 health professionals from 7 different disciplines at 3 different organizations, all of whom work as part of these inpatient rehabilitation teams. These were physiotherapists, occupational therapists, speech-language therapists, dietitians, social workers, nurses, and doctors. They understood values to mean what is important and meaningful to the patient. It's about what matters, what is motivating, and what your priorities are. These could be things like cultural values, family values, or particular hobbies. And preferences were related to likes and dislikes, choices and goals. These could be preferences for how you like people to communicate with you, or where you might like to do your rehabilitation. And circumstances were related to the physical, social, and environmental context around you. It's about where you live, the effects of your stroke, and the social support you might have once you're discharged from the hospital. The health professionals talked about a variety of ways that they collect these puzzle pieces. Sometimes using formal strategies that are common in rehabilitation. For example, engaging in interviews, doing goal setting, having family meetings, and completing outcome measures. But they highlighted the informal opportunities where puzzle pieces were uncovered more spontaneously. For example, by observing family dynamics, having casual conversations during therapy, or listening to patients tell stories during groups. I found that building the puzzle relies on many people. I might collect some pieces from you, your family, and your clinical notes, but the pieces I have only make up a part of your puzzle. Each team member needs to share their pieces with one another to help build that picture together. The relationships I have with you and your family are important. We need to build rapport, have trust, and good communication for you to be willing to share your pieces with me. Puzzle pieces are collected in different ways from different sources at different times. We need to be flexible and modify our approach as people and situations evolve. We also gather these pieces gradually over time. It's like going on a journey together and collecting pieces along the way. Now, it is important to note that the environment we are in influences how we collect and share these puzzle pieces. For example, if the hospital's priority is to get you home as quickly as possible, it can be difficult for the team to collect enough pieces to build a reasonable picture. Overall, the strategies used, so what clinicians did, and the approach applied, how they did it, were both essential to putting those pieces of the puzzle together. Integrating patient values and preferences has been shown to improve treatment adherence, patient autonomy and satisfaction, and health outcomes. I believe that if health professionals have a shared understanding of these terms and recognize the value of these puzzle pieces, they're in a better position to provide holistic, empowering, and truly patient-centered rehabilitation.